One of the great challenges in medicine, especially in the modern era, is the healthcare leader is trying to balance big data, cutting-edge research with a fundamental sense of caring for the patient. How do you deliver the sense of care in caring while still delivering cutting-edge science?
I knew that anything that involved Stanford GSB, the design school, was going to be something that was really going to challenge your mind in a new way, not your typical leadership program. And then when I saw that it had the interdisciplinary work with the medical school, I felt like it was my life wrapped up in a program.
The Innovative Healthcare Leader Program is a new offering here at Stanford University that's offered jointly between the School of Medicine and the Graduate School of Business.
The Innovative Healthcare Leader is tremendously exciting for me because we're really capturing a synergy that is everything that Stanford's about.
Abraham said something in one of his lectures that has stuck with me, which was that the Stone Age didn't end because we ran out of stones. And as I'm thinking about things changing in medicine, it's not that the things we have aren't working, it's just new things keep coming.
One of the goals of the 21st century leader is to remove the impediments to creativity, remove the impediments to innovation. And this course is really about understanding what elements in your culture or perhaps even in your own personality or in your workplace are actually preventing you from allowing innovation to happen.
One of the great strengths of the Graduate School of Business is the way that they've championed design thinking.
The D-School is unique. That was one of the wonderful parts of this program. It helped strip us down a little bit. The team approach, coming together with people that you didn't know, and through the process of working together here, we challenged each other and came up with different ways of thinking of a problem.
The design thinking methodology allows us to break big problems down into small, manageable chunks and then innovate to develop solutions for those problems in a way that feels much less overwhelming.
We're on the edge of this disruptive industry, and it's really helpful to step back from that a bit and focus on strategies to be even more effective in that role.
I'm leading a program that has grown dramatically over the past 2 years. I really hadn't thought about some of the challenges that would come up in that process. And I feel like I'm going back with some tools to better manage that change now and to help my team better be a part of that process.
A bit of compass resetting is an important part of the week here. So at the same time that it does represent an investment in time, the return on that investment is the chance to rethink the direction that you're moving in your institution or in one's hospital or workplace.
The healthcare leader of the future has to worry about the patient, but also about the welfare of the people taking care of them. Nothing else is going to work if your workforce is unhappy.
This intersection of some of the best minds in medicine and some of the best minds in business will offer healthcare leaders tools for leadership and innovation to manage change in this ever-changing healthcare environment.
How do we keep that art in medicine? How do we keep that patient contact in spite of all this technology and things that are being pulled from us?
I think there's a gap between our intent and the actual execution, between the wonderful technology we have and the fundamental sense, as Peabody said many, many years ago, that the secret of the care of the patient is in caring for the patient.